Okay, I'll show the area, where I will work, and I'll do the registration. And okay, everything. Okay, and I will sit down, and then let's go start it. Okay, well, first of all, I will talk about the medication. My name is Maria, and today I would like to talk about the medication reconciliation. In other words, we are taking the list from the patient, the home medication, and reconcile it with the doctor's orders with MAR, in order for us to see if it's any duplications or omissions in the medications. And we will see the allergies, check the allergy of the patients to see if he has any, if Mr. Lantern has any allergies to any medications, and he has allergies only to the pineapple and gives him a rash. And I would like to talk about the 6 rights of the medication administration: the right patient, the right medication, the right dose, the right route, the right time, and the right documentations. And we have 3 checks before we administer medication. The first check is done in the medication cart. The second check will be done in the preparation room when you prepare the medication, and you double check it again with the MAR. And the third check will be done at the patient side, patient room, patient's bed. And I will start with the first check. The first check is at the medication cart, and I have the paper with me with a scenario and with the labs, and there's nothing on the other side. And this is doctor's orders with the medications and with a schedule. Okay, and what I will do, I'll go to medication cart, and I will take the medications out, and I will start with the first one, hydrochlorothiazide, and hydrochlorothiazide, and it's 25 milligrams per tablet, and it's per month, and the expiration date is 6/23/2020, and should be given at 9 o'clock in the morning and 17 in the afternoon. That is the first medication. The second medication, and I can show to you. The second medication, it's lisinopril. It's 20 milligrams per tablet, will be per month. Expiration date will be May 26, 2020, and will be given twice per day at 9 o'clock in the morning and 21 in the evening. And we have heparin. Heparin, 5,000 units per milliliter, and we have the expiration date 8/12/2020, and will be subcute every 12 hours, 9 o'clock in the morning, 21 in the evening. And we have the hydromorphone, and we have the expiration date and the milligrams. It's 2 milligrams per milliliter, and will be intramuscular every 6 hours, PRN when it's needed for lower back pain. And we have the last medication. Actually, it's a test. It's a tuberculin skin test, and has 5 TU per 0.1 milliliter, and the expiration date is 6/23/2020. And this is the first check at the medication cart. And now we'll go to the second check, and I will wash my hands. Okay, and we'll go to the preparation room, where we'll get the supply cups, we'll get the alcohol pap, we'll get the syringe, we'll get the tape, we'll have the pen, everything what we need in order to get ready to prepare the medications. And again, we have to check them with MAR, and I will start with the first medication, hydrochlorothiazide, 25 milligrams per tablet, per mouth, expire in 6/23/2020. And hydrochlorothiazide, we need to check first the potassium level, the labs. The potassium is 4.2, which is in normal level. And of course the other electrolytes, which is in good range, and the renal function, BUN, and creatinine. Creatinine is a little bit high, 1.7, but will be okay. And the blood pressure, it's 172/94, and we'll put it in the souffle cup and we'll open it when we give it to the patient. The second one is the lisinopril, and check it with the MAR. MAR, lisinopril 20 milligrams, lisinopril 20 milligrams per tablet, would be per mouth, and expire in 5/26/2020, and will be given twice per day, in the morning 9 o'clock and 21 in the evening. And lisinopril is for the blood pressure, and we should check the blood pressure value 172/94, and we should check pulse as well. The pulse is 90. Okay, and we can check the potassium 4.2, and the creatinine and BUN, the kidney functions, and they are okay. They are going good. And I'll put it in the souffle cup, ready to go. And by the way, I can put these souffle cups on the clipboard, which will help me to take the medication in the patient's room. The next medication is the heparin, and heparin, it's high alert medication, and I need a second nurse to show it when I draw it in the syringe. And I will check it with MAR 5,000 units per milliliter. 1 milliliter has 5,000 units, and it's subcutaneous every 12 hours, 9 o'clock and 21 in the evening. Expiration date 8/12/2020. And the heparin, we have to check the platelets value. It's Mr. Lantern values is 129,000 platelets. It's okay, because the normal value is between 130 to 400,000 platelets. I should hold the medication if it was below 100,000 platelets. And I should check the PTT. The PTT is 37. It's in a normal range. The PTT for patients which are taking heparin is between 30 up to 70, even up to 85, which means that he's okay. And now I will draw I need the alcohol swab, and I need the tuberculin syringe, and I have the syringe here. And the heparin, it's a multi-vial dose. Then I have to put air in, and I'll put air in, 1 milliliter of air. Okay, and I will clean the vial, and I will put it. Okay, and I will push the air in, and now I will draw one milliliter. Okay. Okay, and I have the syringe very careful, and I show to the second nurse. It's 100 milliliter, and I will put the tape on and write down heparin 5,000 units, international units for 1 milliliter, and I will put it on top of the needle, and I will hold on the vial and the syringe and put it here on the cart. Okay, and the next one will be the hydromorphone, which is a morphine, and I should check to be sure the respirations are above 10, the blood pressure, the systolic blood pressure is above 100, the pulse should be above 60. If they are below these numbers, I should hold it, but the patient are doing good. The respiration is 20, the pulse is 90, the blood pressure, the systolic is 172, which means that I can go ahead and administer. And his lower back pain, it's 8, and it's throbbing, burning. And then I'll go ahead, because we don't break the ampoule, we should break it. We should put a swab around it and break it away from us. And by the way, we should put it in the sharp containers, the ampoules, after we took the solution out. But because we don't use this, we'll use and draw the hydromorphone from this vial. And I have the syringe. It's a 3 milliliter syringe, and if I use the ampoule, I have the filter needle in order to avoid any glass to come in, but I don't have. I will use the vial, then I will use the 22 gauge, 1.5 inches long, and I will take the syringe out. I will put the needle in. Okay, and I will clean it the top, and I need 1 milliliter. Okay, 1 milliliter, 1 milliliter. Each milliliter has 2 milligrams, and of course the expiration day was 5/26/2020, and will be for lower back. And I'll put the air in, 1 milliliter air, and I will clean it well, and put a syringe and put the air in, and then I will draw cautious. Okay, I'm drawing. Okay, and now I'll cap it very careful. And this is 1 milliliter. Okay, and I'll put the label. Hydromorphone, and I have 2 milligrams in 1 milliliter. Okay, and I'll put it here on top, and of course I'll put the vial and everything with them together to double check the bed, the side of the bed. And the last one will be the tuberculin skin test, and will be 5 TU, 0.1 milliliter intradermal. Okay, which intradermal, and because our Mr. Lantern works at the homeless shelter, he may have been exposed to people with tuberculosis, and plus he just finished the chemotherapy, which means that his immune system is affected as well, and in the past he smoked as well. Then all these factors are contribute for the doctors to indicate the tuberculin test. And what I will do, I will clean it, and I will take the tuberculin syringe, take it out, and I will put 0.1 air in it. Okay, and I clean it already, but I will clean it one more time because I put my put it in, put the air, flip it over, and take 0.1. 0.1 solution. Okay. Okay. And this is done. And I'll cap it very careful. And 0.1 0.1 milliliter, and I'll put the name. Okay. Tuberculin skin test. I have 5 TU in 0.1 milliliter. Okay, and I'll put it here, and I'll put everything together on this one. And of course, I'll go to the patient room. I will take my clipboard, and I'll have everything with me to get to the patient room. I have the water, I have the washing my hands, and gloves, and the gloves. Okay, and okay, now I will start to administer the medication. I'm going to knock to the patient's door. I enter. I will wash my hands. Introduce myself. My name is Maria Harris. I'll be your nurse today. And may I have your name and date of birth? Jack O'Lantern. The date of birth, it's 5/9/20 1949. Good. And do you have any allergy to medications? No. Okay. But I have allergy to the pineapple and I'll have rash. Okay. Well, today I'm coming to give you the medications which the doctor ordered. And the first medication which I want to give it to you, let me put the gloves on. I wash my hands, and I would like to wash my one more time and put the gloves on. Okay, put the gloves on, and now I will give you the first medication, and I need to double check with MR first, and the MAR is hydrochlorothiazide, 25 milligrams per tablet. Good. Per mouth, it's expire in 6/23/2020, and this morning at 9 o'clock I have to give you the medication, and I'll check it out, and I will this medication the doctor indicated, it's a water pill to eliminate excess of water. And as you get out from the bed, I will encourage you to raise in stages, because may cause dizziness, and we don't want you to fall. And we'll check the blood pressure. Now it's 172/94, and later on in the day we'll come back and check it again to see if it's if it's effective for you, this medication. And we double check the potassium level, the labs value, levels, the oxygen, and the blood pressure. And I will give you some water. Are you okay to swallow this medication? Yes. Okay, I will give it to you. Give you some water. Good. May I check to see if it's went well down? Okay, good. Went good. You swallow it. Great, great. Now we'll we'll do the second medication. It's lisinopril, and this medication is for your blood pressure. It helps to drop the blood pressure, and this medication may make you dizzy. And again, I encourage you to rise in stages and be careful when you get up not to fall. And of course, we have to check the creatinine levels and the BUN because it affects the kidney, and we should check the potassium as well. And we'll check your blood pressure as and the kidney level as we go, even the urinary output. And I'll give it to you to swallow it. Okay, we'll open. I'll give it to you to swallow. I'll give you some water. Good. And may I check to see if it went down well? Okay, good. You swallow. Great. You did a very good job. Okay, and now we'll go to the third medication, and I have the heparin, and I will check with MAR, 5,000 units and per milliliter, subcute, every 12 hours, 9 o'clock in the morning. And I check the bottle, I check the label of on my syringe, and I will tell the patient that check with the patient if he has any bleedings, if he's gum bleeding or nose bleeding or the stool. And I would like to check your legs to see for the swelling if you have any blood clotting, because this medication is to avoid any blood clots, because you are more in bed now, more sedentary. We don't want you to get any blood clots, and this medication is to prevent the blood clots. And please let us know if you have any bleeding or any nose bleeding or gums or big bruises. Please let us know. And I will want, do you remember when was given which site was given the heparin last shot? Oh, you don't remember? That's okay. I can check an MAR. I will check the site. Okay. And heparin is given subcute only in abdomen and should be rotating the sides. Okay. And okay, was given in the left upper quadrant, then I will give it in the right upper quadrant. Okay. And what we do, this is the side. Before I will give, I would like to tell you the other sites for subcute shots are the upper part of the arm, is the anterior side of the thighs, is the back side of the back, between the lungs, and the lumbar side too. Okay, then I will clean the side. Okay, I'll remove the cap of the syringe. Okay, and clean the side. I will pinch it, and I will put the needle 90. Okay, and you can put it 45 or 90, and should be in adipose tissue. And then I'll just introduce slowly, and I should give it 2 inches from the umbilical. I should give it from any scars, any stretch marks, any incisions, old incisions, from any bruises, 2 inches. And give it slow. I will not aspirate and I will not massage. Okay, and now I'll just take it out, and that's it. And this I'll put it in the sharp container. Good. And then the next one, it's hydromorphone, and I should check the with MIR and check with my ampoule, and it's 2 milligrams per milliliter. The expiration date 5/26/2020. I should it's PRN for lower back. I should assess the pain, ask the patient where is the pain located, what type of pain, and how the scale, and the patient told me, Mr. Lantern told me that it's 8, and it's lower back, and it's burning and throbbing. Okay, then this will go intramuscular, but before I will give it, I need to check the respiration, the pulse, and the blood pressure. Everything is going smoothly. And what I will do, I will have the alcohol swab, and I will give it ventrogluteal. I can give it in deltoid, the intramuscular sites, deltoid or vastus lateralis, uh, or ventrogluteal, and I'll give it ventrogluteal. That is in the back, and we have another site, dorsogluteal, but it's a site where it's not used anymore because it's not safe because of the nerves, sciatic nerve. Then I'll give it ventrogluteal, and I will wipe it. I will take the cap of the syringe. Okay, and what I will do, I will taunt the skin. Okay, already I wipe it, and I will introduce the needles, and I will aspirate. Good, and I will do the injection very slow. Okay, and now I will take it out, and I can massage this. I can massage this, and this will go in the sharp container. Okay, good, and then I'll finish. And the last one will be the tuberculin test, and I will check with the MIR, and it's 5 TU in 0.1 milliliter, and expires 6/23/2020. It will be intradermal. It will be only 2 days, and will be, I'll check with the label, which I put it on the syringe, and everything will be good. And I will tell the patient that this is given because of him working at the this is a test to check to see if you have any tuberculosis, because you are working in the homeless shelter. You may be exposed to tuberculosis, and not only that, but because you had the cancer, the chemotherapy, your immune system was suppressed, and you smoke in the past as well. And we'll give it in the ventral forearm area, and can be given subclavicular and between the scapula in the back area. And this test will check it after 48 hours, 48 to 72 hours, to see the reaction. Please do not scratch it. Please do not put soap or lotion. Just leave it, because we want to see the true reaction, if you have it or not. And what I will do, I will wipe it. Okay, I will remove the cap of the syringe, and then the bevel should be up. Okay, the bevel should be up. I will taunt the skin, stretch the skin, introduce the bevel just a little bit, and the angle of the syringe should be 10 to 15. And just as the bevel enter, and you introduce the solution, and should create a wheel on top. And I will not aspirate, and I will not massage. I will just take it slowly out and leave it like that. And this will go in the sharp container. And I should document the sites where I did the injections, the intradermal, intramuscular, and subcutaneous injections. I should put the sites. I should put vital signs and all the assessment which I did, and I should write the time and the date when I administered the tuberculin, and when the tuberculin, the skin test, should be checked. I should put the time and the date as well, and do all the documentation. Take the gloves off, wash my hands, and be sure that I will put the bed of the patients as low as possible, lower. I'll put the bed rails up. I'll put the call light for the patient to call us, because if he's dizzy or had any side effects of the medications, for him to be able to call us. And that we'll put a bed alarm as well, because of the medication he can be dizzy and get up in the bed without calling us, and we want to avoid any falls and any dangers to the patient. And we eliminate everything, be sure that everything is nice and neat after we finish, take everything out, put everything in the trash, and that's it.